Today our topic is investigations of the carpal tunnel syndrome. It involves X-ray. X-ray is used to check for the fractures around the carpal tunnel syndrome, osteoarthritis of the wrist, and anatomy of the wrist. Second, MRI and ultrasound. You just remember that in X-ray, you advise a special view, that is carpal tunnel view. Carpal tunnel. It is the best view to study the carpal tunnel. So, what is carpal tunnel view? You just dorsiflex your wrist like this, and you hold the X-ray cassette beneath the wrist. This is the carpal tunnel view. Another is your MRI and ultrasound. Any space occupying lesion is checked in this MRI and ultrasound. NCV. To see the extent of median nerve involvement, or the degree of nerve injury that is seen in carpal tunnel syndrome by checking the latencies within this nerve conduction velocity. Then comes your provocative test. First is your Tinel sign. Why provocative? Why are they called provocative tests? Because they provoke, induce, or excite the symptoms of carpal tunnel syndrome. What is Tinel sign? You lightly tap or percuss the nerve from distal to proximal. Basically, it is done to check for the irritated nerves. Can use it in the carpal tunnel syndrome, cubital tunnel syndrome, anterior tarsal tunnel syndrome, cubital tunnel syndrome, carpal tunnel syndrome. In Tinel side, and if this is the carpal tunnel, the nerve is from distal to proximal. It is lightly percussed this way, and the replication of symptoms within the distribution of the median nerve within after percussing the nerve, if the symptoms get replicated, that means that Tinel sign is positive in this case, and that's the diagnostic that you can assess that it may be the carpal tunnel syndrome. Next is the Phalen's test. What is Phalen's test? Static holding of wrist in extreme flexion or extension for 60 seconds. When you will hold the wrist in extreme flexion, it is called Phalen's test. When you hold it statically in extension, it is called this is when you hold it in flexion, it's called reverse Phalen's test, and when in extension, it's called Phalen's test. You hold the wrist this way for 1 minute in flexion, this time in dorsiflexion for 1 minute. Or it's also called the wrist extension. And if this way, the flexion is called reverse Fallon's test. So within 1 minute, the symptoms get replicated. Then another test, that is the Durkan's test. To compress the carpal tunnel just close to the proximal wrist crease for 30 seconds. And if in this period the symptoms are provoked, then this is the positive Durkan's test. It is indicative of carpal tunnel syndrome. It's the proximal wrist crease. You just hold the wrist this way and compress here at the carpal tunnel for 30 seconds. The onset of symptoms means the Durkan's test is positive in 30 seconds. These were the provocative tests. Durkan's test is also called the manual carpal tunnel compression test. Now, treatment. Nerve gliding. First, I should go for the medical treatment. NSAIDs are using corticosteroids. Pyridoxine. NSAIDs are used to decrease the pain, decrease inflammation, and the most commonly used NSAIDs are the itericozib, isclofenac, diclofenac. NSAIDs, these are not steroidal anti-inflammatory drugs. They decrease pain and they also decrease the inflammation. There is no benefit by the use of NSAIDs, then corticosteroids are preferred. There are two types of corticosteroids. One is local and the another is oral. If you are using oral, you should be aware about the side effects, oral side effects, because by using it orally, there are systemic side effects. Nobody will wants the systemic side effects. So the local or the intra-articular route is preferred. But there is one disadvantage, that you may hit the median nerve. Another is the pyridoxine. The use of pyridoxine has been shown to decrease the severity of carpal tunnel syndrome. So, in physiotherapy treatment, supplantage. You give the patient supplant. What it does, it holds the wrist in neutral position. When you hold the wrist in neutral position, the symptoms, this compression within the median nerve is decreased. Means the symptoms of carpal tunnel syndrome gets relieved. What is neutral position? It's the neutral position. In the neutral position of the wrist and the hand, the palm and the wrist are in one and the same plane. This is the neutral position of the wrist. This is not the neutral position. This is not the neutral position, but this is the neutral position of the wrist. And you should keep it on. That is, you have to wear it throughout the night, because nocturnal pain is common in carpal tunnel syndrome. When you are using it throughout the night, there are less chances of the fluid getting accumulated around the carpal tunnel, and also there are you can't flex it during night, as happens involuntary during night, that you most of the time you keep wrist this way. So by this, it decreases the symptoms. Next is the use of this modalities, that is IFT, ultrasound. You are using TENS. You can also use the laser. IFT and TENS, you are aware of it, and you can also watch my videos on IFT and TENS. There it's the dosage of IFT and TENS I have discussed in detail. Here I will discuss about this, the use of ultrasound and laser. Because since the effect of ultrasound is dose dependent, and also of the laser. When you are using ultrasound as it is prescribed, as it is written in the books, you will get most of the benefits. If you are using it in the trial and error manner, you won't get any benefits out of it. So ultrasound, dosage of ultrasound. First, if it is acute, you have to use the pulsed mode, and the pulse width is 1:4. That is 1 second on and 4 seconds off. And if it is chronic, it means 1:1. Acute means less than 6 weeks. Of the less hand is than 6 weeks. And the intensity. This is pulse duration. This is intensity. Intensity for ultrasound, if it's acute, less than 0.5 watts per centimeter square. If it is chronic, 0.5 to 0.8 watts per centimeter square. And duration for acute, it is 2 minutes, and for chronic it is 5 minutes at the maximum. And also frequency of ultrasound. You know, frequency is inversely proportional to the depth of penetration. If the depth of penetration is, if the condition is superficial, you need less depth. If it is a deep condition, you need greater depth. You need the ultrasound to penetrate in the deeper layers. So, since carpal tunnel syndrome being a deeper condition, so you need lesser frequency. You have to use the lesser frequency. Since in physiotherapy, we are using 1 megahertz to 3 megahertz ultrasound. Since 1 megahertz, if you are using 1 megahertz, it will penetrate deeply because of inverse relation. So 1 megahertz is the preferred frequency of ultrasound which is used. Laser. What is laser? Light amplification by stimulated emission of radiations. So in laser, we are having 12 joules, 9, 12 and 30 joules per centimeter square, maximum of 30 joules per centimeter square. You can use with 3 to 4 days interval, after every 3 to 4 days, and a maximum of 10 sessions. Greater than 90% remission of symptoms is achieved if it is used in the early phases. of carpal tunnel syndrome. Now, exercises. Nerve gliding. Nerve gliding exercises. What is the use of nerve gliding exercises? Decrease scarring. It increase mobility of nerves. Mobility of median nerve. Myofascial release of flexor retinaculum. It's another exercise. In this, the flexor retinaculum is distracted transversely, or transverse carpal ligament is distracted. It is distracted transversely. It gets stretched, means decrease in the symptoms, decrease in the compression and relief of the symptoms of carpal tunnel syndrome. And the last one is the opponent's roll maneuver. You just hold the thenar and hypothenar muscles and thenar. You just hold them, distract the thumb laterally into extension. Laterally. The opponent's muscle and the transverse carpal ligament gets stretched. Means when it gets stretched means decrease in the compression on the median nerve, means release of the symptoms of carpal tunnel syndrome. And now the practical demonstration of exercises for the carpal tunnel syndrome. There is another video you have to watch for the practical demonstration of exercises. So I think that is my 5th video. You have to watch it. Class dismissed.